Ulcerative colitis (UC) is a chronic inflammatory bowel disease (IBD) that causes long-lasting inflammation and ulcers source in the lining of the large intestine, colon, and rectum. It is one of the two main types of IBD, the other being Crohn's disease. Unlike Crohn's disease, which can affect any part of the digestive tract, ulcerative colitis primarily affects the colon and rectum. Causes of ulcerative colitis. The exact cause of ulcerative colitis is not fully understood, but several factors may contribute to its development. Immune system dysfunction. UC is believed to be an autoimmune disease in which the immune system mistakenly attacks a lining of the colon, causing inflammation and ulcers. It may be triggered by a virus or bacteria, but the exact trigger is unclear. Genetics. There is a genetic predisposition to UC, meaning it tends to run in families. Individuals with a family history of IBD are at higher risk. Environmental factors, lifestyle factors, including diet and stress, may contribute to flared UPS or worsen symptoms. However, these factors alone are not the direct cause of UC. Gut microbiome. An imbalance in the gut's bacteria may play a role in the development of UC. Symptoms of ulcerative colitis. The symptoms of ulcerative colitis can vary in severity and may come and go, often in cycles of flared UPS and periods of remission. Common symptoms include diarrhea, often with blood or pus, abdominal pain and cramping, generally in the lower abdomen, especially after eating, rectal bleeding. This can be from small ulcers in the colon. Urgency to defecate, a frequent, sudden need to have a bowel movement. Fatigue, due to blood loss and inflammation. Weight loss, often due to malabsorption and decreased appetite. Fever, sometimes occurs during active flared UPS. Mucus in stools, this is common during flared UPS. Types of ulcerative colitis. UC can be classified into different types based on the extent of the disease and the location of inflammation. Ulcerative proctitis. Inflammation is limited to the rectum. Symptoms may include rectal bleeding and a feeling of urgency. Proctosigmoiditis. Inflammation is confined to the rectum and sigmoid colon, often causing abdominal cramping and bloody diarrhea. Left-sided colitis. Inflammation extends from the rectum to the left side of the colon. Symptoms include abdominal pain on the left side and more severe diarrhea. Extensive colitis. Inflammation affects most or all of the colon, leading to more severe symptoms and complications. Pancreatitis, the most severe form of UC, where inflammation affects the entire colon. It can lead to significant bleeding and more serious complications. Diagnosis of ulcerative colitis. The diagnosis of ulcerative colitis typically involves a combination of the following: medical history and physical exam. The doctor will ask about symptoms, family history, and previous gastrointestinal issues. Stool tests, to rule out infections or other causes of diarrhea and abdominal pain. Blood tests, to check for anemia, infection, and markers of inflammation such as elevated C-reactive protein CRP or erythrocyte sedimentation rate ESR. Colonoscopy, a procedure where a flexible tube with a camera is inserted through the rectum to examine the colon and take biopsies. It is the most definitive test for diagnosing UC. Flexible sigmoidoscopy, similar to colonoscopy but only examines the rectum and sigmoid colon. Imaging tests, CT scans or MRIs may be used to check for complications like abscesses or perforations in severe cases. Treatment of ulcerative colitis. There is no cure for ulcerative colitis, but treatment aims to control inflammation, reduce symptoms, and achieve remission. Treatment can be broken down into two main categories: medical management and surgical intervention. 1. Medications. Medications are often the first line of treatment for UC. These include aminosalicylates 5-ASAs. Anti-inflammatory drugs such as mesalamine, sulfasalazine, and alsalazine are commonly used for mild to moderate UC. They help reduce inflammation in the colon. Corticosteroids, Prednisone or hydrocortisone can be used to reduce inflammation in severe flare UPS. They are typically used for short periods due to potential side effects. Immunosuppressive drugs, medications like azathioprine or mercaptopurine may be used to suppress the immune system and prevent flare UPS. Biologics. These are advanced medications that target specific proteins in the immune system, e.g., TNF inhibitors such as infliximab or adalimumab, and integrin inhibitors like vedolizumab to reduce inflammation. JAK inhibitors. Tafasitamab is a newer oral medication that can be used for moderate to severe UC when other medications are not effective. Antibiotics. Sometimes prescribed to treat infections or complications like abscesses. 2. Diet and lifestyle changes. Dietary adjustments. While no specific diet cures UC, a well-balanced diet that avoids trigger foods, spicy foods, alcohol, high-fiber foods during flare UPS may help manage symptoms. Hydration. It's important to stay well hydrated, especially when diarrhea is frequent. Probiotics. These may help in balancing gut bacteria, although their role in UC management is still under investigation. Avoiding stress. Stress does not cause UC but can worsen symptoms. Relaxation techniques like yoga or meditation may be helpful. 3. Surgery. If medications do not control symptoms or if complications arise, surgery may be necessary. Surgery for UC may include colectomy, the removal of the entire colon. This is often recommended for people with severe disease or complications. Ileostomy. After a colectomy, an ileostomy may be performed, where the small intestine is diverted to an opening in the abdomen, and waste is collected in a bag. J-pouch surgery. For many patients, after a colectomy, the surgeon can create an internal pouch called a J-pouch from the small intestine, which is then connected to the anus, allowing for more normal bowel function without the need for a permanent ileostomy bag. Complications of ulcerative colitis. If not managed properly, ulcerative colitis can lead to serious complications, such as colon cancer. Long-term UC increases the risk of colon cancer, especially if the disease involves most of the colon for an extended period. Toxic megacolon. A life-threatening condition where the colon becomes severely dilated and inflamed, leading to the potential rupture of the colon. Perforation of the colon. A tear or hole in the colon, which can lead to peritonitis, infection of the abdominal cavity. Bleeding. Severe ulcerative colitis can cause significant rectal bleeding. Osteoporosis. Long-term steroid use can weaken bones and increase the risk of fractures. Liver disease. UC increases the risk of liver diseases, including primary sclerosing cholangitis (PSC). Nutritional deficiencies. Inadequate nutrient absorption due to chronic inflammation can lead to deficiencies in vitamins and minerals. Outlook for ulcerative colitis. While ulcerative colitis is a lifelong condition, many people with UC lead active lives with proper management. The goal of treatment is to control flare UPS and prevent complications. With advances in medications and surgical options, people with UC can often achieve long periods of remission and maintain good quality of life. Regular checkups with healthcare providers and monitoring for complications, such as colon cancer, are essential for long-term health.